Okay, can you guys see my screen now?
Yes.
Okay, thank you. So we have, as a lot of you know, oh no. Can you guys see my slides or just like the presenter view?
Yeah, I think if you just hit swap display,
Okay,
you'd be set.
awesome.
Perfect. That looks great.
All right, so we're located in northern Arizona, so that's in Flagstaff, Arizona. So a lot of our border tribal communities are Navajo, Hopi, San Juan Paiute, Hualapai. So there's like 19 tribes in Arizona, so we're lucky to have a good diverse population at NAU. And some of the things that, considering that we have a large presence of Indigenous communities and tribal members, we try to strive for incorporating Indigenous determinants of health into our curriculum. And we have a specific track for Indigenous students. So one of the first things that we do, what we recently started offering is called a Graduate Certificate in Public Health. And that's a certificate where you take 4 classes, and I'll get more into that. And then we have our overall Masters of Public Health program, where we have a nutrition program. So students are getting their MPH as well as getting their degree in nutrition. So when they graduate, they'll be registered dietitians once they pass their exams. And then we have a health promotion program. And once students enroll into this health promotion program, they're able to select Indigenous health track. So although they're degrees in health promotion, we offer elective courses. And if they're in this track, they have 3 courses that they're required to take, which are specific to Indigenous health systems. So that's the Indigenous health track and MPH. And then we have an MPH online, and we're excited to also announce that even though it's an online program, our professors that teach the Indigenous health courses, they're also able to offer those classes via Zoom. So it's called NAU Flex. They'll still be enrolled as an online student, but with those 3 specific courses, they'll be able to take it through Zoom. I've added like a designated time during the day. Most of them are like for the fall, we have 1 course that's going to be offered from 4 to 6. So that's the good thing about that program. And then, so with our graduate certificate in public health, there are 4 MPH core courses that students take. And with our MPH programs, you can see the difference in credits. So the nutrition program is definitely a 2-year program. But with the MPH programs, they're able to, if they want to fast track and move through the courses pretty quickly, then it could be in 1.5 years. And again, same thing with Indigenous health, and with the Indigenous health track, they're able to complete within 1.5 years. And again, that one could be taken online as well. So the G-Cert courses that we offer are epidemiology, social and structural determinants of health, health policy and management, environmental and occupational health. And these courses, again, you can take it online or residential. And then we have that option of Flex, which is Zoom courses. And our requirements for all of the graduate programs that we're offering is they have to have a bachelor's degree in any major, as long as they have taken a introductory course to statistics. And it could be any statistics course. It could be a statistics course in psychology, social science. So we look at that, and as long as the student has some type of background in statistics, we really like to see that course taken within the past 10 years. So, we want to make sure they're prepared to take courses like the epidemiology course. So our application process, we ask for transcripts, and usually we're okay with unofficial transcripts in the, when you submit your application. But once you're admitted into the program, of course, we want to ask for that official transcripts. Also, resume or curriculum vitae, statement of purpose, that personal statement that we really look at. And I also review applications for the MPH program here at NAU. So that's something that really makes a difference in an applicant, and separating them from other applicants is that personal statement. And all the programs do not require the GRE, and the deadlines for the graduate certificate is for a fall deadline is May 15th, and for spring it's November 30th. And you'll also notice that for this program, you don't see letters of recommendation, and that's for the certificate program. So for early admission, we really encourage students to apply in January, because that's when we, we're able to offer them teaching assistant positions or graduate research assistantships. So, that's the benefit of applying early with January 15th. And then for the application for Indigenous students, we do have limited application waivers available. So, that takes care of that $65 application fee. And with your personal statement, it's about a 2-page personal statement that includes questions about, career goals and reasons for applying to NAU, and, reasons why you're going to apply to public health programs specifically. And if you're interested, or if you have questions about this certificate program, you can email me. I'm the person that answers all the emails for the Ask MPH at nau.edu. So I respond to those ones. And then we have our MPH courses. These are the core courses that both programs take for health promotion and nutrition. And you'll see, the 4 courses for their certificate program are all listed here. So if someone were to take the graduate certificate program, they could easily transfer in those 4 courses, and they'll be ahead. Maybe they'll cut down their MPH time to a year to a year and a half. So that's the cool thing about the certificate program. It's really ideal for people that maybe want to just, take one course at a time and see how it goes. I highly recommend that if you're just kind of wondering if the program's for you. And then for health promotion, we have these additional courses, as well as, again, if they're just, MPH health promotion, they have 4 electives. For Indigenous health track, they take American Indian health and healthcare systems, CBPR course, and then determinants of Indigenous health and resilience. So those are the 3 credit elective courses that the Indigenous health track students take. And then for the overall MPH program, pretty much we have the same process. We have, they have to have a bachelor's degree, have taken a basic statistics course. In addition to the application here with the MPH program, we ask for 3 letters of recommendation. Priority deadline is the same of January 15th, and a final deadline of May 15th. For the nutrition program, they do require more courses to take. In addition to that statistics course, we ask for introductory course into nutrition, anatomy, physiology, chemistry, microbiology, and food safety. The food safety course can be taken online, and we do have all of that information on our website. So for this one, I have to let you know that this is a highly competitive program, and we usually fill most of the spots by January 15th. So if this is something you're interested in, you have to pretty much apply in January to get into this program. Every once in a while, maybe we have 1 or 2 applicants that's going to decline. So, maybe we might be looking to fill 1 or 2 spots in April, but majority of the time it's filled by January 15th. So the application asks for, concentration you are applying for. So this is for your personal statement that we review as part of the review process. So if you are a member of an underserved community, really highlight that, and maybe highlight your experience of living in that community and how that experience is going to help you, or how the MPH program is going to help your community. And also personal characteristics and experiences that have prepared you. So definitely highlighting, your experiences such as internships, research experience, any type of public health experience that you can highlight, that would be great. Also aligning your career goals with your decision to apply, just pretty much stating why the MPH is going to help you in your future career. So, if you're looking into being a health educator at a tribal program, state your goals and exactly, how you see yourself using your MPH degree. So those are things that we really look for. And we kind of have like a rubric that we're looking at and seeing, did the student answer this question, is this something that they mentioned? So, make sure that you're answering all the questions in any application that you apply for, or making sure that you're answering everything that the institution's asking for in your personal statement. And then for the 3 letters of recommendation, we would like to have one from a faculty member, manager, supervisor, and then either or instructor or manager again. And the reasons for these, again, we want to see you as a student and your recommender to be able to state what type of student you are. And then if you've been part of a, from work, whether it's research or outside the university, we also want to see a letter from them. And again, for tips, making sure that you're asking for these letters of recommendation early, as well as, making sure that you're connecting with your instructors so that they're able to remember you. And, when you ask for a letter of recommendation, they're like, oh, okay, I know so-and-so, highly motivated student, came to office hours. So, make sure that you're forming those relationships and expanding your network, because you pretty much are going to have to lean on them, on those people that you're forming relationships with for recommendation letters later. So here are some of the careers in public health that you could get with each type of degree. So with a graduate certificate, we've seen you can become a health specialist, research assistant, or a public health educator. With the MPH and Indigenous health, more of those director positions within tribal programs, senior research staff, working on, again, tribal community research maybe. And then for MPH and health promotion, again, similar job titles, health director, public health educator, and senior research coordinator. And with the MPH in nutrition, clinical dietitian, public health dietitian. So if you have any questions, again, you can email me, and this is my askmph@NAU email address. And if you're interested in, visiting all the programs I talked about, you can visit our website. So it's the end of my slide. All right, so I see some questions in the chat.
I think we're gonna hold off on questions right now. Thank you so much, Jamie. We'll circle back at the end. Again, if you do see questions in the chat, you can answer them directly in the chat. But as far as like the verbal answering, we're gonna hold off on that for now. Olivia, we're gonna have you jump in. Olivia is with Johns Hopkins. Please introduce yourself and then jump into your presentation. Thank you.
Thank you, everybody. Let me pull up my slides really quick just so that I'd be ready. Okay. Yat she Olivia Trujillo Yenishia Ashihan Nishlan Sinsakani Bashichin Kia Ani Dashiche Dobit Ati Dashanele. Hello, everybody. My name is Olivia Trujillo. I am a member of the Navajo Nation. I work at Johns Hopkins Center for American Indian Health, and I'm also here representing the Johns Hopkins Bloomberg School of Public Health. Just to give some information about our graduate programs, as well as some information about our institute programs that we offer through our center as well. So thank you so much for having me here, and I'm looking forward to answering as many questions as I can as possible. So just to start off, I feel like I'm kind of reiterating a little bit of the information that Jamie talked about, but I'm going to start off with our certificate program as well, just because I feel like at Hopkins, we strongly encourage everybody to apply to our certificate program first, just so that you can get firsthand experience about the classes that you will be taking at Johns Hopkins in the future, as well as a lot of our certificate credits that will be earned can be transferred into the master's program at Johns Hopkins, or also transferred to other master's in public health courses as well. And so what is included in our public health training certificate for American Indian health professionals? I know that's quite a bit of a mouthful, but what it is that we are an 18 credit graduate program. We require 3 courses, and I'll go through the courses a little bit. I think it's after this slide, but we have 3 required courses and 5 electives that you can choose from. And our courses focus on topics in public health, but look at them through an Indigenous lens. And a lot of our faculty are Indigenous, as well as we bring in a lot of community members and community partners who are working on the ground in Indigenous and tribal communities. And let's see, so we do have different deadlines for our institute. We offer them our courses in the winter as well as in the summer. So usually in January and July, but because we are moving our entire we have moved our entire certificate program online, we kind of spaced out the classes this summer as well. So we'll be offering our courses over the span of 3 weeks, and we'll be offering 3 courses. So through July and August. And one thing that we encourage is that students to take 1 course at first, or 1 to 2 courses, just like I said, so they could get a feel of what the coursework and course load is like. And then the reason why I say that is because our certificate program requires you to finish in a 3-year span. And I feel like this just gives you a little leeway to kind of decide your course plan, when you want to take courses, just because when you do apply through the Sophus Express website, you do have to complete the courses pretty consistently in order to finish within the 3 years. Let's see. And like I said, this is a great opportunity for students to get their foot in the door. If you're looking to apply to Hopkins, just like I said, just because a lot of these credits can be transferred. And these are the courses that are currently on rotation and we are offering. The first 3 that are highlighted in blue are our required courses. And with the first course, an interdisciplinary approach to understanding the health of American Indians, this is kind of our core foundation course, just because it gives you an insight into all, or not all, but a lot of the topics in public health. So public health policy, environmental health, a little bit of epidemiology, data collection, and mental health. So I feel like it kind of lays the foundation on all the public health topics, but gives you a little taste of everything. So I feel like that's kind of one of the main courses that we do offer, and we offer it every single winter. The other courses highlighted in green are our elective courses. And we let people pick and choose what topic they're most interested in. So also, this is a chance for people to learn about other topics if they're not really sure what each topic entails. So that's just kind of how we see people getting able to find their career path, is basically learning about new topics and being able to have that freedom to choose your own course plan as well. Okay, so I did mention this before, that the reasons to take individual institute courses, it's just that it is your first time at an institute. You kind of get the feel of the Hopkins style of the way things are taught, as well as our courses are during 1 week. So it is a little bit of an intense course, just because you do get that graduate level courses in that short amount of time, or graduate level credits, excuse me, in that short amount of time. And like I said, it's a chance for you to kind of get a feel for it. And if you're not really interested in committing to a full program at the point, that just gives you another option as well. And just to give you guys an update of what courses we're offering this summer, we are offering the Collecting, Analyzing, and Using Public Health Data in American Indian Communities. We're offering Early Childhood Research in Tribal Communities. And I know I'm kind of flying through this, but I feel like they'll probably, or I can also follow up with this information so that you have all of this information later with the dates and times as well, just because, like I said, they're not offered all at the same time. The last class is the Intro to American Indian Health Research Ethics. And like I said, all of our institute courses will be online, and that's kind of the reason why we offset the dates, is that we understand that people have already been on Zoom for long hours of the day, and we want to kind of cut that time a little bit as well. And we do provide scholarships for students to attend our institute. Our registration for classes is currently open. We do have scholarships available. They can be found at our website, caih.jhu.edu. We have extended our application deadline. So I know at first it was supposed to be on May 1st, but we have extended it to May 15th, just to give students some extra time to get their documents submitted. And for students who are members of the White Mountain Apache tribe, there is also a NARCH scholarship available for you. Their deadline for that scholarship is on July 7th. And if you do want more information or learn how to apply to that scholarship, I've listed my colleague Ryan Grass, who is the coordinator for that scholarship. So please feel free to send him an email and ask questions. Otherwise, I would be glad to forward on your questions and get you in contact with him as well. So moving into Johns Hopkins Bloomberg School of Public Health, these are just some quick facts. So they're ranked number 1 in the US, known as a public health leader. We are currently trying to get more Indigenous students to attend Hopkins. So that's one of the main pushes the center has been working for the last couple of years. A little bit about the Bloomberg School student life. There's about 2,347 new and continuing students, and all of these students do come from all over the country as well as all over the globe. There is about a 5-to-1 student faculty ratio, so there is a lot of help and support getting through the MPH program, as well as our center is located near the School of Public Health and the medical school campus. So we like to offer as much support as we can to students who are looking to apply, as well as who get accepted into the school. Our research is global. So students tend to go across the world to do different types of research. But I feel like a lot of our Indigenous students tend to keep it local. So not only do we have local research in the Baltimore community, but we also try to keep it local to tribal communities as well. So our center, the Johns Hopkins Center for American Indian Health, we work a lot with tribal communities in the Southwest, as well as in the Duluth area. So I I tend to think that's local for me just because that's where I'm from as well. And like I said, we do like to support Indigenous students. So if they do want to pursue their master's degree, but also want to conduct like their capstone or any of their final projects in tribal communities, we do really try to work with them and connect them with faculty members or PIs who work in our center to really connect them to projects that they might be interested in working with. And these are the current academic departments that are included at the School of Public Health. And a lot of these interests can be combined. So I feel like it's really what interests you in the school, and you can really make it your own. So you can really put together your own plan of expertise and your own plan of where you want to study. And Bloomberg today, the academics, so there's the academic degrees, there's professional degrees. They also have fully online degrees. And just to give you some background, there's 9 types of master's degrees, 2 types of doctoral degrees. And also, not only is there the certificate in American Indian Health that I just mentioned, but there's also 19, or it says 20 different certificates offered to degree seeking students as well. And also non-degree seeking students can take other courses in other certificate programs as well, just to get more information on different topics. So our certificate program isn't the only one, but we do like to advertise it as well, just because we have a lot of Indigenous students interested in doing research in tribal communities. And whoops. And so I also want to talk about student groups. There's a lot of student life in the School of Public Health that offers support to students, try to engage people who do move to Baltimore if they're doing the in-person track of their degree. But I also want to mention that our center does have a Native student group and faculty, a group that we have put together. It's called Native Circle, and this includes Native faculty, Native staff, and Native students. In the past, we have included students kind of in the medical campus area, so the School of Medicine, the School of Public Health, and the School of Nursing. But obviously, we have realized that the Native community at Johns Hopkins is very small. So we are trying to reach out to the other schools across campus to see if we can get them involved in our Native Circle group as well. And this group, like I said, consists of Native scholars, but we as a center, we really try to give our Indigenous students the support that they need in terms of giving them a sense of community. So when we were in person, we did offer like luncheons, socials, just so that we can interact with one another. We've also worked on different initiatives at the school. So we really worked hard on getting like a land acknowledgement noticed, or wanting them to acknowledge the land that the university stands on and where we work. So I feel like our students had a real passion for that. And the School of Nursing actually does a land acknowledgement now. And recently, we've also seen a lot of our school-wide events include that as well. So that's one thing we were really excited to help work with the school. And degree details. So there are different pathways to take when applying to Johns Hopkins. So there is the MPH program, or there's other master's programs, many master's programs that are also included at the School of Public Health. So I'm just going to walk through some of the differences between them. So the Master of Public Health is a school-wide program. And the one thing that kind of differs or makes a difference between the two programs is that they require 2 years of post-baccalaureate public health related work experience. And there are two options to do this route. There's a full-time option where a student can complete the whole program in 11 months. They do have to be on campus in Baltimore to do this portion. Otherwise, there is the online part-time option, and that gives the students the option to take classes while also continuing to work. And students are given up to 4 years to complete that route. And there are optional concentrations, like I said, as well as you're able to customize your program, however, with what interests you. And these are the other programs that I mentioned, the Masters in Bioethics program, the Masters in Health Administration, the Masters in Science and Public Health, the Masters in Science, the Masters in Health Science, and the more specified Masters in Science kind of geared towards epidemiology. So these are other master's programs that are available through the school, and they don't, the difference is they basically don't require the 2 years of experience before applying. So if students are just graduating with their bachelor's degree and they're ready to move right into their program, this is kind of the route they would take. But of course, if you do have any questions about any of these programs as well, please feel free to give me, shoot me an email or put it in the chat. And these are the next two slides are the programs that are fully online. So the Masters of Art in Public Health Biology, as well as the Master of Applied Science. So these programs are really designed for working professionals, therefore them being all online. And the school also offers 2 doctoral degrees, so the Doctor of Philosophy as well as the Doctor of Public Health. We currently have some Indigenous students who are in both of these programs. I feel like one of each in these programs, and they are thriving. However, like I said, there's not a lot of Indigenous students at Hopkins, so we are really trying to push for more students who are seeking doctoral degrees as well. And so just some information to give you on how to apply to these programs. It's always important to do your research. Always good to look into the accreditation that is being offered through each school, as well as the research center and the affiliations that go along with them. We have heard from a lot of our Indigenous students that have applied and been accepted into Hopkins. And we do say that if you are interested in applying to Hopkins, that you reach out to our center just so that we can give you the extra support, kind of walking you through the admissions process, as well as we do contact the admissions office as well and saying, hey, this is an Indigenous student, we really support them and would like to follow their application through the process. So I feel like we really want Indigenous students to get through the process and to get accepted into it. So we really try to push for our Indigenous students. It's also important to look at the size of the institution and what type of support they can offer. Like I said, the school obviously is very large, so the center really takes a big part in providing support to our students. The students who are accepted into our program, we do different check-ins with them as well, trying to see how they're doing with their grades, how we can help if they need tutoring, if they need support. So we just try to find out where the help is needed. So that's why we always keep tabs on our students. And the admission requirements. So all of the applications are submitted through SOFAS. So kind of like the Public Health Common Application process. Transcripts, official transcripts are required, 3 letters of recommendation, resume or CV, personal statement, and test scores. So like I said, when I tell students to reach out to our center for help, this is kind of the area that we're looking for as well. So we also help building students' resume. We help put together students' personal statement. So if you do have any questions or need somebody to read or look over those types of documents, we have people who have been a part of the admissions process at the school. So we do get some of their expertise and try to ask them what specifically they're looking for in everybody's application. We also provide letters of recommendation. So that's another reason why we encourage students to take part in our institute courses, is because students get to meet faculty, we get familiar with their work ethic, with their career goals. So I feel like once we're able to build that relationship with students, we're able to write really good recommendation letters to the School of Public Health in support of our hopefully future Indigenous scholars at the school. This past year, the school did not require any test scores. So that's one thing that we were really excited about as a center. In the future, I can't say that that will be the same, just because Hopkins has honestly really liked, I don't know why, the submission of test scores in the past. So we're really hoping.
Yes, but we do have to move on to the next presenter. I'm so sorry.
Oh,
We're
okay.
really short on time. Moving forward, if you can keep your presentations to 10 minutes, just so we can try to get as many people to present, and also a couple questions, that would be wonderful. Very sorry, Olivia, if you can put your contact information in the chat box, that would be excellent. Thank you.
Yeah, no worries. Sorry about that.
No problem. University of Arizona.
So good afternoon, everybody. This is Agnes Hadikai. I'm with the University of Arizona, Arizona Health Sciences. So I just want to make sure you're seeing my screen.
Yes, we are.
So are people seeing my screen? Yes, okay, good. So this will be a drive-through of all the different programs that we have at the University of Arizona Health Sciences. So again, I'm Agnes, program manager for the Arizona Indians into Medicine program. I also run a couple other programs. So at the university, so when you're looking at graduate schools, just like Olivia had stated, you really have to think about whether a graduate degree or certificate program will provide you additional skills other than the bachelor's degree that you have. So really think about that, because that's either a 2-year to a plus year commitment, and that also includes financial aid. So really think about that. And then next, finding the right school that fits you. So this is where you start doing your homework and attending sessions like this, attending virtual college fairs, looking for a school that offers you that the program that you want, and then also based on your interests, what they offer. Again, looking at the kind of support they have for you. Review the program experiences from graduate schools. As graduate students, ask other students what was their experience, and they will be honest with you about whether they were supported or not. Again, reviewing your financial aid package, if they have application waivers, what scholarships they offer for you, because again, if you're taking on a graduate degree program, you're actually, looking at either financial aid scholarships or loans, so you might be adding to your financial debt there. Meet with staff and faculty at events, or you can contact them through their university or college emails and ask them about their different programs. And again, reviewing admission requirements, timelines, whether they require admissions tests, and making sure that you have a timeline for yourself in place so you apply when it's best for you. And also, when you're preparing yourself for graduate school, is really taking advantage of research, clinical experience, leadership experiences, because all those are really important for your admissions application. Specifically for health professional schools, they will require you to have some research, some clinical patient experience, and some leadership experience. So you're telling your whole story of why you're this awesome applicant for this school. Okay. So in health professions, we have at the University of Arizona, we have medicine, we have nursing, pharmacy, public health, and our new addition is vet medicine. So with medicine, we have several medical degree pathways. We have, of course, the traditional medical degree. We have joint degrees such as a medical degree and a PhD, an MD, MBA, MPH. And we also have a pre-medical admissions pathway programs, and you apply for medical school. And if you don't get in, you can apply for the pathway program. And if you're selected, it's a 1-year conditional admissions program, which they prepare you and strengthen your science skills, and you get accepted the following year. Some new programs that have happened that may be applicable for students, especially at the University of Arizona, if you're on UA Honors College has an early assurance program. It means that as an undergraduate school student, as a junior, you can apply for our College of Medicine. And if you get in, you are guaranteed admissions. We also have a new accelerated pathway and medical education program for high school students. When they apply to the University of Arizona, they also apply to the medical school. And so if they're selected, they get automatic admission and a select pathway for them to prepare for medical school. In nursing, we have several degrees in nursing: Masters of Science in Nursing, entry to the profession. You have the Doctor of Nursing Practice, Doctor of Philosophy in Nursing. We also have graduate certificates for those who are at the postmaster's level, and these can take up to about 15 months. So specifically on autism spectrum, healthcare informatics, nurse practitioner certificates in adult gerontology, acute nurse practitioner, in family, pediatric, and psychiatric mental health nurse practitioners, and also a certificate in rural telehealth. So these are the types of programs that are offered at our College of Nursing. Now, specifically for Native students, we have an Indians into Nursing program called NCATS, and it's now it's a 5-year grant from the Indian Health Service, and it's applicable for those who are members of Native communities. They're nominated by their tribal partner, and the purpose is to increase the number of registered nurses in the field. So if you want to become a registered nurse, this is a great program. So you have to be accepted and enrolled at the U of A in a Bachelor of Nursing, the MEPN, which is the Master's in Entry Practical Nurse program, or the Doctor of Nurse Practitioner or Family, or Psychiatric Mental Health Nurse Practitioner programs. And for that, you get tuition and stipends, mentorship and support while you are at the University of Arizona. And once you finish the program, you have to have an Indian Health Service payback obligation of 2 years for every 1 year of funding that you're provided. And veterans do receive priority admissions and consideration. And in this program, so far we've recruited, I'd say, about 10 folks into the program. We've graduated on average 2 Native students to get their doctorates of nursing. We have several that have gone through the master's program. So it's a really great program. I help students with their application process and also with a letter of recommendation as well. So if you're interested, please contact me or the College of Nursing, which is basically nursing.arizona.edu. In public health, we have, as on the screen, a variety of different masters of public health degrees in environmental health, epidemiology, global health, health behavior, health promotion, health services administration, maternal child health, public health policy, and dual degrees as well. So if you're interested in doing public health and physician, law, business, pharmacy, American Indian Studies, or Mexican American Studies, that's allowable. And there's also graduate certificate programs in health, public health, global health, health administration, clinical translational research. So if you're interested in public health, these are offered at the University of Arizona. Admissions is very similar to our other programs that have presented: a bachelor's with a 3.0, coursework in biology, coursework in math like algebra, pre-calculus, calculus, letters of recommendation, resume, CV, purpose of statement, mission, value statement, resilience statement. GRE scores. A lot of our health profession schools have started not using GRE scores. There's waivers, so there's debate whether those should be permanent. So please look on the website to make sure that you are applying for a school that if they are doing GRE to take that. If not, then you don't. And then of course, there's specific concentration admissions criteria. So this is where it's really important to have all those different programs as an undergraduate school where you are getting experience in research and volunteer work and community service work, because that really helps with your statement of purpose, why you want to go into public health. And really, one other thing is to look at the mission of the school that you're applying for, because they will ask you how you fit within the mission and vision of the College of Medicine, Public Health, Pharmacy, and that's where you try to find that fit for whatever school you're going to. Now, pharmacy, we have a Master's of Science in Pharmaceutical Sciences, a PhD in Pharmaceutical Sciences, and a PharmD program. Again, very similar to medicine and nursing, chemistry, organic chemistry, anatomy, physiology, biology, microbiology, and physics. And those are the type of classes that are really general and specific for those who are going into the health professions, specifically medicine, nursing, and pharmacy. You should be taking these classes and getting A's and B's for that specific track you're going into. Again, admissions is very similar. Again, having those specific criteria there. Now, our newer program is a College of Veterinary Medicine. So it was accredited just recently. So as part of the application process, you're reviewing the essential qualifications for veterinary medical students. They have a very similar application process to medical school, the Veterinary Medical College application system. So that's where you upload your letters of recommendations and essays. You have a GPA requirement, and if you meet those requirements and the prerequisites, then you're given an invitation to complete supplemental assessment and then completing the MMI process. And very similar to medical school, you have an application process. You go through the first round, you meet the minimum requirements, you're invited for an interview. So in that secondary application process is where they do the interviews and get to know you a little better. And for both vet medicine and medicine, it's the MMI process, which is the multi-mini interviews where it's basically scenario based. So you do rotations of 5 to 7 rotations, and you're placed in scenarios and you respond to those scenarios. And this is where they evaluate and observe your problem solving and critical thinking and communication skills. And that's why it's important to have, as during an undergraduate, being able to take leadership positions, doing community service, knowing who you are and what your purpose is, because those really come through. And we are very fortunate in our first year of the College of Veterinary Medicine, we have 5 Native students who have applied and are accepted and started the vet medicine program. And these again are just the requirements for vet medicine, very similar to medicine and pharmacy, biology, physical sciences, math, arts, and humanities and social sciences. And this is just a timeline for our College of Veterinary Medicine. Many times, and again, it's like a year-long process just for like our College of Medicine. So making sure you know when to apply for these graduate programs. Now, a couple other programs I wanted to address, which are very tangential to health careers, is we do have a Master's of Arts in Library Information Science. We have a program called Knowledge River, which is focusing on Black, Indigenous, and people of color. So this is a particular program where you learn about information science, and they do have they have scholarships for underserved students from underserved communities. And it's a wonderful program. As you know, in a virtual environment, information sciences are very essential. So this is also a great program. Another program we have, a post-bac, we do have a program called Prep at the University of Arizona for those who have a bachelor's degree and want to strengthen their skills to going and receiving a PhD in biomedical sciences or research. So this particular program is a year-long mentored program. You get funding for the program while you're in it, and you graduate with a certificate in foundations for biomedical science. PhD and serving Indigenous culture. So this is a particular program which is of great interest to a lot of folks. They usually recruit enroll about 4 each year. So usually 4 students each year. So these are a variety of the different programs that we offer at the University of Arizona. And I know it's a really short drive through, but I wanted to go through and cover each of those. And really, again, going back to the first page of really knowing yourself, knowing why you want to go into a graduate program, knowing about the programs you're applying for, and preparing yourself is really essential. You start that at the undergraduate level. I know there are some folks that, as far as incoming freshmen, they say, I want to be a doctor. So we work with students. And at the University of Arizona, we're very fortunate that we've recruited a lot of students for our health professions program. As I said before, in our vet medicine program, we have 5 students that have started the program. College of Nursing, we graduate about 2 with the Doctor of Nursing or nurse practitioner each year, along with master's level students and bachelor students in nursing. In pharmacy, we're graduating 2 with a PharmD degree who are American Indian, and we have several students who've applied. In medicine, we have on average 26 Native American medical students across Tucson and Phoenix campus, and this year we're graduating 4. In public health, we have bachelor's, master's, and PhD programs, and we do graduate several each year. So we offer support for our students in preparation for graduate schools. For our students at the University of Arizona, we offer MCAT assistance and workshops, GRE assistance and workshops, personal statements, interviews. We do application workshops year round. We review personal statements. We meet one-to-one with students. And for those who are transferring to the University of Arizona from community colleges, we work with community colleges students and offer the same assistance. We work with you one-to-one, advising via Zoom or in person when that happens in the future. We review transcripts, and so we support students. And if you decide to go to another university other than U of A, that is fine with us. We've had students who've gone to Oregon Health Sciences, Duke, Columbia, Madison. So wherever you go is fine with us. You find that niche, you find that good program for you. And so that's what I have. Thank you very much.
Thank you so much. Okay, up next is the University of Colorado.
Yeah. Hey, everybody. So I'll start sharing my screen here so that everybody can take a look here. And let's see. Can we get this in presentation mode is the trick here. All right. Are we good? Are you guys seeing what I'm hoping you're seeing? The normal screen?
It looks great.
All right, great. Well, hey, so we've heard a lot already from some amazing schools, some amazing programs, and I think that many of you are starting to pick up some similar messaging, some similar kind of approaches to what to be thinking about when approaching higher education, graduate school. And so I don't want to berate you with more information than you need. So I'm going to do a quick run through of what we have to offer here at the University of Colorado Anschutz Medical Campus. And also just give you a brief introduction to a newly started American Indian Alaska Native Health Certificate program that we've got in the works. And so that program is largely run by folks here at the Centers for American Indian Alaska Native Health and the Department of Community and Behavioral Health. And so I'll kind of we'll do a bit of a funnel. So I'll start really wide and kind of just give you an introduction to the campus here on Anschutz Medical Campus, and then drill down a little bit more until we get to this certificate program. So when we're thinking about the University of Colorado Anschutz Medical Campus, we have about 5 schools and colleges that you can consider in terms of your interest. So we do have the School of Medicine, the College of Nursing. We do have the Skaggs School of Pharmacy and Pharmaceutical Sciences, Dental School, and then also the School of Public Health. So I'm a professor in the School of Public Health, so I'm going to kind of drill down again and just be talking to you a little bit more specifically about the School of Public Health. But there is a host of information out on the website about these different programs. Like the School of Medicine has a rural track program, which is somewhat unique for a School of Medicine nowadays. A lot of places have moved away from that. So we have one of the few programs focused on rural medicine, if that's something you're interested in. And we have a lot of efforts going on that I think will help Native students or folks that want to partner with and help Native communities in all of these schools and colleges. But I'm just going to kind of run through what we have going on at the School of Public Health. And so at the School of Public Health, we have several programs that are offered: the Masters of Public Health, the Masters of Science of Public Health, our DRPH, so if you want to get a doctorate in public health, a PhD in public health. So each of these have their own set of requirements, their own set of concentrations, programs that you can jump into. And I think that that's really important, as other presenters have already suggested to you all. It's really important for you to know, at least have some idea of what your end goal is. And so for someone like myself, I knew my end goal was to do research, helping and contributing to the health of Native communities. And I took a windy path to get there, but each step of that way was focused on that end goal. And so that's not to suggest you have to have the perfect answer right now, but be mindful of what's your end goal. Do you see that through nursing? Do you see that through clinical work? Do you see that through research? And then really start making those choices of which program might be right for you, depending on that end goal. We also have several certificate programs, one of which I'll be talking to you about. And as some of my co-panelists have also mentioned, our school has many dual programs. So if you're really want to get a public health degree, but also really want to receive a degree in social work, we've got programs like that. So I've put a link here for you all if you are interested in looking those dual programs or these programs individually. But largely our departments are also here on the right. So we have biostatistics, informatics, and informatics, community and behavioral health. That's the department I'm an assistant professor in, environmental and occupational health, epidemiology, health systems management and policy. Again, each department with their own focus, with their own set of skills that you're going to get if you choose to opt for one of these departments over others. So I'm just throwing it out there for us to be mindful of what may be right for you as you enter this space. And so we are located in Colorado, obviously University of Colorado. But a lot of the programs that we're hearing from today, we're hearing from folks in Arizona, Baltimore, all over the place. And so our school is somewhat uniquely located in the sense that we're close to a lot of the Great Plains tribes. We have folks on the Rocky Mountain tribes. We have folks down south in the Southwest. So it is somewhat centrally located, which is we view as a benefit because easy access to being able to quickly respond to community needs. And so again, just drilling down a little bit more, and I want to leave some time for my other presenters here. So in the summer of 2022, we will offer a fully online certificate in American Indian Alaska Native Health. So why online? So this extends research regardless of whatever time zone you're in. It provides flexibility for working professionals. So many of you may be graduating right now or really soon, and maybe you want a gap year. Maybe you want to spend some time going back to the community that you serve, and it's not feasible for you to live in Baltimore. It's not feasible for you to leave your reservation or home community and go to Minnesota or wherever that program may be. And so we're hoping that through this online program, it provides some flexibility for you to be able to still serve the community, your family, and the people that you surround yourself with, while still also allowing you to get exposure and get a certificate program that will make you more marketable in terms of jobs, in terms of potentially other programs that you want to apply to afterwards, if that's other master's degrees, medical school, clinical programs, whatever it may be. Hopefully that this provides one of those gateway opportunities for you to kind of be able to do both at the same time. And so in terms of what that certificate in American Indian Alaska Native Health looks like and what is required. So it's a 15 credit hour program. It can be completed online in 1 year. So you'll be taking several core classes. So Foundations in American Indian Alaska Native Health, that's a 3-credit course, which I teach. Ethics and American Indian Alaska Native Health Engagement. It's a 1-credit course taught by Dr. Kaufman. Community Engagement and American Indian Alaska Native Health, again, taught by Dr. Kaufman, 1 credit. And then she has one other course that she teaches, which is Tribal Research and Review Fundamentals, which is 1 credit course. And then you'll also be required to take a Social Determinants of Health course from Dr. Braga, which is a 3 credit course again, which leaves you with 6 credits for electives. And so the School of Public Health has a host of online classes that you would be options for you to take as you round out this certificate program. And like I said, it would start in summer 22 and you would be able to finish by summer 2023. And so if you're curious about what are some of the content that we covered, I don't think it's largely unique to from some of the other programs I heard. I have an adjunct position with the Center for American Indian Health with the Hopkins team, and you heard a lot about what they're offering. And so a lot of similar content in terms of the content that you'd be covering, ethics, historical trauma, role of culture, health disparities, the importance of treaties and understanding how that relates to health, self-determination, and a host of other factors, right? But we hope that this not only gives you this content for you to think about, but it also provides you that Indigenous lens to approach, at least for us, public health. So you'll be taught a lot in public health about these core pillars of public health and what those means, statistics or environmental health or whatever it may be. But we hope to kind of ground us in, if we take an Indigenous perspective to that, what does that look like? And I think that we have a lot to teach, inform, and improve the health of our country and the world by taking an Indigenous perspective. And so we want to amplify your voice. We want to dig deep in these topics and help everybody out with public health issues from an Indigenous perspective. So that was a quick and dirty overview of some of the programs, some of the schools, at least one certificate offered here at the School of Public Health in Colorado. And if you have any questions about what is the eligibility, what are the requirements, what are the considerations you should be making, please just reach out to me. I think it's easier to have a one-on-one conversation about what can we do to help you as an individual rather than rattle off a bunch of requirements that oftentimes aren't very different than what we've already heard today. So I appreciate your time, and I want to leave some time for my other panelists today. So I'm going to go ahead and turn the time over to them. And I appreciate you all listening and hearing me out.
Thank you so much. That was great. Okay, up next is going to be the University of Minnesota.
Okay, I am trying to share my screen and I'm getting somebody else's. Don't know what's going on there. So let me get back out of that. I have this issue every once in a while, and I cannot use both screens, so I have that shut off. Do I have to be on as a host to share?
You do not. You do not.
Okay, we'll try it again. There we go. And let me get it in the proper view format. And that is not it. Sorry. I shared before we got started. I feel so modern whenever I can make these things work. At least what I'm looking at is not a presentation mode, or is it different for you guys?
It's kind of a presentation mode. Why don't you try to click to another slide just so we can see what you're.
Okay.
I think that'll do. Yeah, it looks good.
Okay. So to start with, we take a little bit of a different angle at teaching American Indian public health and wellness at the University of Minnesota. We actually use courses which directly apply, so that our graduates can go out into any Indian community, any tribal community, or any urban Indian community and hit the ground running. And so what we have as a requirement by our university is, you see the second slide there, and we are a land grant university, which if you know about how awful that is for Indian people, is duly justified. But anyhow, so we acknowledge that we are located on Dakota land. We recognize the vast amount of indigenous knowledge that this land has seen and encourage everyone to be respectful of the distinctive and permanent relationship that exists between the Dakota people and their traditional territories. We would also like to pay respect to our elders, both present and past, to allow us to be here today. So thank you for that. And these are our 11 tribes in Minnesota. If you look in the middle where it says Leech Lake, and if you can see my cursor, I don't know if you can, but it's the bottom left corner. That's where I'm sitting right now, is home on the reservation. I'm very happy to be here. Next. Let's see here. Okay, so we offer American Indian Public Health and Wellness Certificate. And we also offer a graduate minor. The certificate is a Regents certificate. In other words, you do not have to be an enrolled student to achieve this certificate. And you can read there. I'm not going to take the time. I'm sorry, my slides are a little bit busy, but it does require 12 credits and the criteria of pass, fail, or AF. But the all students in my classes, I have a variety. I have some American Indian students, but mostly non-Indian. And I have multidisciplines. I have MDs, I have veterinarians, I have nurses, I have social workers, I've had mayors, probation directors, which was interesting, but and other business majors. So it truly is a public health model. And within each of these classes, there are a total of 6. And I have used my 28 years of experience working for tribes, actually doing a lot of workshops and training for federal employees, state employees, and just wherever we need to help people to understand the true government to government relationship that federally recognized tribes have with the federal government, and not necessarily with a subordinate of the federal government, meaning a state. So that's a summary of the certificate. Now the minor, you do have to enroll as a student, and it's the same classes. As I mentioned, a total of 6. And for the master's level, you have to take 6 of the required courses, and if you're a PhD level, you have to take all 12 credits. And so next is the first class. I'm trying to move along quickly here, so we got time for our last presenter. This is a required class for everyone, certificate, major, just whatever. I always recommend this class. And this is something that I use. A lot of my documents that I've saved over the 28 years are not digital, so they have to be scanned. I share, in this particular class, there are 60 different documents, but they include copies of the law. They include copies of how do you do a billing system for clinics, how do you manage clinics, different forms for policy and procedure in clinics, just whatever you need to be an administrator for American Indian Health Services. The second class is a class I'm currently teaching. It's called Cultural Humility. This actually competes with one of my pet peeves is it's in my opinion, humanly impossible to be culturally competent. I don't even feel competent in my own culture because it's ever evolving. And so this is a very interesting class. Once again, multidisciplinary. And it talks about how important it is for providers to understand, first of all, their own culture and respect that, and then reach out and learn about the cultures of their patients or their clients that they're working with. A lot of the public does not understand that there's 574 federally recognized tribes, 74 state recognized tribes, that they really don't have any advantage in regards to appropriated dollars from Congress. But in the same sense, it is part of life. And in our opinion, class after class, students without fail always say, I had no idea. And so some of it's pretty hard to teach. Cultural humility is a tough class to teach because given all the situations that we're in our current lives, I allow students to share things that they're comfortable in sharing. They don't have to if they don't want to. I do restrict it to the topics of humility. But regardless, it's very hands-on, very driven, and they go away in their final evaluations asking, why don't other disciplines offer this? Don't know, but we do. Next class is the research class. Consequently, I don't use the R word on the reservation. Not a lot of good history that goes along with that. And I'm often challenged by others, well, why do you have to teach research for American Indians? I said, well, if you only knew. And it's a sad situation. People do not know that tribal governments may control any research that's done with their populations by law now. So within this class, we develop data sharing agreements, we develop memorandums of understanding, memorandums of agreement, we develop other forms. A lot of laws are shared within this, but a lot of procedures on how to do stakeholder-driven research with tribal communities, not 2 or 4. A quick story, I used to get calls as a clinic director and a person would say, oh, we're coming up to the reservation next week. I go, is that so? And they say, oh, you won't even know we're here. And I go, well, that's probably not a good thing to share. I'm asking you to keep on going. And so it's a huge burden that universities bear to this day. We are still trying to overcome that, and hopefully we will. The next class that we offer is American Indian Health and Wellness Equity. Let's see, the teeny print on my screen is hard for me to see. And this is something the state of Minnesota started about 10 years ago. Both the dean and I sat on a state program where a committee where we stopped talking about disparities because quite frankly, we've not moved the dial anywhere, including Minnesota. And we started focusing on equity, which in the bottom line is it allows us to share the strengths of our communities, the resilience of our ancestors so that we could be here today. So this is a really kind of fun class to teach. And we actually, the university has actually developed our own public health and wellness equity model and identified a lot of things. I've shared that routinely across the country. People will like it. I'll send this presentation to the providers here so they can share the information with you. Next is American Indian Environmental Health Studies. And this is really a hard class to teach. And incidentally, we are going to do all of our classes by Zoom, which was serendipitous because I'd rather be here than in Minneapolis. I'm kind of a rural girl. But realistically, these classes target, and especially the certificate class, targets people who work for the states. As a clinic director, I had so many negative experience with states that, you know, they wouldn't even talk to you because their excuse was, well, we don't know how to approach the tribe. Well, you know, that's an excuse and that's baloney. But in the same sense, we teach those methods so that people can go out in their respective states and actually contribute and be of assistance to tribal populations. So, but the environmental health studies, especially right now, is a very contentious topic to teach. Students don't understand the government to government relationship. They ask me, well, what do you think about the pipeline? I go, well, I believe Standing Rock said no. And I stop and then they kind of stand there and I say, well, it's a tribal government. I'm not second guessing any tribal government, but just examples like that. And then lastly, we have a general history of health and post-colonization and review of historical trauma. This also is a hard class to teach. Remembering, and I tell my students, and one of them actually wrote it for class tonight in their analysis, but history is told by the winners. So if you just have that as a basis in your thought process, this historical trauma is totally devastating. The whole colonization era to this day remains devastating. And so we go over documents, we go over histories, we go over leaders that helped lead their respective tribes out of that disparity and forward. And so in all, I'm going on now to the application process. I put the website on there, and this is for the certificate. And remember that you do not have to enroll as a student, and you have 4 years to complete the program. And that time frame begins the term and the year that you're admitted. And I actually have a number of local American Indians that are quite interested for the fall semester to start this. So it's a process. And next we have for the graduate school enrollment, we have a website there that you can go through. I did not put everything on here because I just thought it'd take too long, but just general purposes. If you click on that link there, it'll go through, and the bottom, it also shows where you can ask. And if you want to know me about my culture, it makes me very uncomfortable to talk about myself, but if you want to check out my CV, you can go through on that and find more information there. And then one of my favorite things doing any presentation is have a pretty picture. And so lastly, it's fundamentally necessary to understand that the Indian health system is unlike any other. It serves the poorest, sickest, and most remote populations in the United States. Each tribe's culture undergirds and guides their elected leadership to meet their respective unique needs in this complex environment. And that is specifically what our classes target, is applied knowledge and how to do that. And then lastly, those of you who know about Minnesota, this will be an ice road. And we use them pretty frequently. My staff, I told them they couldn't use it, any ice road, but I know they did, but they just didn't tell me. So that's the end of that. And then lastly is my contact information. So I think I made that in time for our last person.
Charlie, I don't know if you have, I know you have to hop off. If you want to say a few things here in the last couple minutes, the time is all yours.
Certainly. Yeah, happy to do that. Let me turn on my camera here and see if I can share my slides. We will do a short and sweet abbreviated version. So hi, everyone. My name is Charlie. Again, I work in the admissions office at the Harvard Chan School of Public Health. A lot of my presentation echoes what a lot of my colleagues said today about public health programs. So I'll kind of dive through quickly and show you a little bit about the different opportunities we have. But unfortunately, I do have a hard stop in about 7 minutes. So I apologize in advance if this is a little whirlwind. So a little bit about the school at a glance. We are sort of a medium-sized school of public health compared to some of our peer institutions. So we have just under 1,000 students. And we have about 69 different countries represented. So compared to like Hopkins, we're quite a bit smaller, but on the whole, across all the different public health schools, we're about average sized overall. A little bit about where we're located. So Harvard University is located in the greater Boston area. And if you're familiar with Harvard in general, you may be familiar with Cambridge, people talking about that campus. And that's where the vast majority of the different colleges and graduate schools are at Harvard University. But the School of Public Health is located on the medical campus. So that's on the south side of the Charles River in the city of Boston proper. And then this snapshot is a map of the Longwood Medical Campus. So the School of Public Health on the left-hand side of the screen, kind of highlighted in that bluish grayish color. And then adjacent to us to the right is the School of Dental Medicine, and then the rest of the campus is the Harvard Medical School. So we're very much a medical community. We're surrounded by 3 different hospitals. We're very much an urban campus right in the heart of Boston. So it's a great place to collaborate, connect, and study the field of public health. Similar to some of my colleagues, we have a lot of different degree programs and degree options. For us, we break down our degree programs to different credit options, which dictates really how long a program takes to complete, as well as some of our eligibility requirements. So for a Master of Science program, this is a master's level program that really focuses on the research side of things. So if you're someone who's interested in research, you know that's kind of your focus, your career trajectory, then the Master of Science would really be the right place for you to take a peek. While the Master of Public Health, the next program down, is really a practice and professional based degree program. So this tends to attract folks that are interested in kind of going out into the field, whether it's program design, implementation, analysis, that type of thing. But it's really more of a field-based program. Master in Healthcare Management is a little bit different as far as the programs we offer. It's a non-residential program for physicians and dental executives. I'm going to skip over that one for now just because that's a super sort of niche program. But if folks have questions about that, I'm happy to field it after. And then last but not least for this slide, we have the two doctoral offerings that the School of Public Health offers. So similar to the master's level, we have both a research and a professional focused doctoral program. So the DRPH is our practice program and the Doctor of Philosophy is our PhD. You can see on a high level the different eligibility requirements that we have. So for the Masters of Science, we're just looking for folks to have certain educational backgrounds, but the Master of Science does not require folks to come in with any prior research, any prior work experience. Well, on the flip side, the Master of Public Health, the MPH, does require folks to come in with post-bac work experience, similar to what my colleague at Hopkins was saying. And for us, we're just looking to see that you've had experience out in the field, and then that experience is completed after the conclusion of your undergraduate studies. So for us, it doesn't necessarily have to be specific to public health. I very much say you can find public health in just about anything, everywhere. I love to tease out examples of public health. So if you have an interest in public health and you have work experience, I bet there's some motivating reasons that you can articulate as to why your different experiences have compelled you to want to seek graduate training in the field of public health. So there's always ways to find those examples, but from a high level eligibility perspective, we're just looking for those number of years depending on the program. A little bit about what the different credit options mean beyond eligibility. So the 45 credit MPH program is our 1-year track. It's 1 academic year, so it's technically 9 months to complete. So it's kind of a short and sweet program. The MPH 65 is a 1.5 year program. So it's a little bit longer, but it's longer because it's making the assumption that folks come in with some prior or with less prior work experience than they would for the MPH 45 credit program. For the Master of Science, the 42.5 credits, a 1-year track, the 60 credit programs, a 1.5 year track, and the 80 credit programs, a 2-year track. A little bit about our different fields of study. For those of you that maybe are already familiar with public health in some way, shape, and form, public health truly attracts students from all sorts of different academic and professional backgrounds. And for us, we're not looking for like one type of student from one type of experience, but we really have students from all over, from education interests to legal interests, policy interest, science interests. So it's really, really broad, which makes it nice because if you have an interest in public health, there's likely a program at our institution or at other schools of public health that may align closely with your interests and goals. So this highlights some of the topics that students can pursue within some of our research programs. As far as the MPH goes, we have different fields of study as well. So the MPH 45 offers 8 different fields of study and the MPH 65 offers 4 different fields of study. So students would just kind of think about similarly, as we talked about in the previous slide, kind of where their eligibility sits as far as their prior education and work experience. We do have one program that is sort of an online hybrid track, and that's our MPH 45 in the field of epidemiology. So if you're someone that knows for sure you're only interested in doing an online program, our MPH 45 in epidemiology would be a great place to check out just because that's our most flexible program that would allow folks to not reside in the Boston area and as well not have to be pursuing the program full time. I'm going to kind of gloss through this one. My colleagues did a fantastic job talking about some of the different requirements we have for admission, but high level, we're looking at your transcripts. Last year, we waived the standardized test component in light of the pandemic. Similar to some of my colleagues, we haven't decided yet if that waiver for the standardized test last year will carry over to this year. So similarly, just check out our website if you are considering applying in the near future to get the most up-to-date standardized test requirements. We also require letters of recommendation, statement of purpose and objectives, which is your admissions essay. And this is really the most important part of your application. So we're looking to see kind of what are your motivating reasons for pursuing graduate training in public health? What's your story? Where, how have your different experiences compelled you to seek this training? And ultimately, how do you find this training advantageous to help you reach your career goals down the road? So just different food for thought, but that really helps us get to know you sort of beyond grades, beyond test scores and things like that to understand why you're passionate about the field of public health. We do have financial aid available. Our Office of Financial Aid has a supplemental application that folks can fill out. They consider students in a variety of different circumstances, service organizations, backgrounds, different things like that. But for now, I'll leave it at high level, but our financial aid website does have a ton of great information about different opportunities the school has. And they also partner closely with the Harvard University Native American Program, which is, we abbreviate as HUNAP, H-U-N-A-P. So if you have a chance to check out their website, there's a ton of great resources about community support, different financial opportunities as well. So tons of different ways to get involved. And with that, I made it just about 7 minutes. So thank you for holding on for that quick wild ride. But my name is Charlie, and I'm happy to connect with anyone who has questions after today's session if you want to shoot me an email. And I'm happy to dive in and answer those questions for you. So thank you so much for having me today.